Right, this is the Capstone and 5-Year Plan by Esther A. Avila for Nursing 4580 at Lamar University. I'm Esther A. Avila, ADN RN. As far as my academic background, I received my Associate of Arts degree from San Jacinto College in 2011. Received my Associate's degree in Nursing from San Jacinto College in 2017. And I am on track to finish my Bachelor's of Science degree in Nursing from Lamar University this December 2018. As far as my professional background, I'm an operating room nurse circulator. I was in the STAR RN cohort of last summer. I am a member of the Da Vinci team, the orthopedic team, pediatric team, I team, Code BERT, which is a step down from Code Gray, Printer Champion of the unit, and Association of Operating Room Nurses, or AORN. I hold certifications in both ACLS and BLS. Humanity and Society. The learning objective number 1 practices safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. The course was Nursing 4620, Nursing Practice, Care of Patients with Compromised Multiple Health States. The assignment was the Practicum Reflections 1, 2, 3, and 4, and my CBSL assignment. In 4620, I interviewed a young college man who was diagnosed with type 1 diabetes in elementary school. We went over a plan that I developed, a plan of care based on current evidence, developed a measurable goal, and also developed 3 nursing interventions to reach those goals. And we discussed Callista Roy's adaptation theory and had a teaching and learning session. As far as the CBSL assignment, I interviewed someone I know with diabetes and reflected on a patient I had cared for. For this project, I discussed the disease process and 3 resources in my community that the patient may benefit from. I felt this goal was met at 100%. For the Lifespan Health Continuum, the learning objective number 2 supports patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The learning objective number 3 evaluates patient-centered care for patients and clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. For the learning outcome number 2, the course was 4316, Comprehensive Holistic Health Assessment. The assignment was Activity 1, Healthy People 2020. For the Healthy People 2020 goals for immunization and infectious disease are rooted in evidence-based clinical and community activities and services for the prevention and treatment of infectious diseases. I spoke about reductions in infectious disease mortality due largely to immunization. Learning outcome number 3, the course was Nursing 4620, Nursing Practice, Compromise Multiple Health States. The assignment was CBSL Community-Based Service Learning Activity. In 4620, I attended a diabetic support group in Houston and visited with and interviewed a couple of people who were happy to share about their diabetic journey and their future health goals. I felt both of these learning objectives were met at 100%. The evidence-based practice and clinical reasoning. The learning objective number 4 synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. The course was Nursing 4550, the Nursing Practice, Leadership, and Management in the Healthcare System. The assignment was our practicum assignment of clinical application. In 4550, I identified a problem in my current clinical setting as it relates to patient safety, using the National Patient Safety Goals. I discussed best practice as far as skin preparation, application, and appropriate drying times, fire risk, as well as patient safety during that time. I felt this learning objective was met at 100%. Patient-client-centered care. Learning objective number 5. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. The course was Nursing 4321, Nursing Theories and Online Education. The assignment was our discussions 1, 2, 3, and 4. For the discussions, we discussed cases from my past clinical experiences that made a difference in how I practice nursing. Also, I discussed Gene Watson's theory of human caring. It really hit home in that I'm a free spirit myself, and I try to be very open and connect with my patients. I feel that in the OR, there is a lesser amount of typical nursing skills at use, but at the same time, a one-on-one approach to nursing and utmost care can be given to this one patient. I feel that's the very definition of nursing. I felt this goal was met at 100%. Professional roles construct. Learning objective number 6. Differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients and clients as a member of the interprofessional and intraprofessional healthcare team. Also, learning objective number 7 demonstrates professional integrity, effective communication, active inquiry, and service to the community. The course for learning objective number 6 was Nursing 4390, Nursing Inquire, Evidence-Based Practice. The assignment was our group discussion and quantitative research. In 4390, our class was divided up into small groups. We communicated via text and phone calls and broke up the quantitative research assignment equally. Each student contributed to the project and submitted a well-written paper on hypertension in patients on chronic hemodialysis. I felt this learning objective was met at 100%. For learning objective number 7, the course was Nursing 4540, Nursing Practice Care of Communities. The assignment was our practicum project, windshield survey, disaster preparedness and teaching plan, video project for teaching at-risk special populations. I felt that helping individuals to learn and grow not only empowers them, but also improves the greater community. It's a quote from the AORN website. In 4540, I determined how a disaster would impact the daily activities and healthcare needs of a community aggregate. I talked to several members of my selected community aggregate, people who suffer from obstructive sleep apnea. I also spoke with an otolaryngologist to help gain a better understanding of patient care. Also, during a disaster, if people with OSA are unable to travel with their CPAP machine or the battery dies, the person is at risk for sudden cardiac death. I devised a plan and teaching video to better reach those in need. I felt this learning objective was met at 100%. My 5-year plan. In 2008, I planned to graduate from Lamar University's baccalaureate program and receive my Bachelor's of Science degree in nursing. In 2019, I plan to test and obtain my CNOR, be a certified nurse in the operating room. In 2020, I'd like to be able to successfully scrub into surgeries when needed. In 2021, I'd like to cross-train as an endoscopy nurse. In 2022, I'd like to be a member of the heart team. And at 2023, I'd like to be charge nurse in surgery. I'd like to thank you for taking a look at my project, and I enjoyed putting this all together. Thank you.